Hello, this is Dr. Reşat Aktaş from Istanbul. I'm an experienced plastic surgeon for lipedema surgery. Today I'm going to reply some frequently asked questions regarding lipedema. Lipedema is a fat disorder, so fat cells affected from this illness. The difference between normal fat cell and lipedema fat cell is actually in lipedema fat cells there is a difference in estrogen receptor levels. In lipedema patients, fat cells affected high estrogen levels more than normal patients. That's why in some periods like puberty, pregnancy and menopause periods, patients affect these high estrogen levels and fat cells probably proliferate with this high hormone levels, and you have this excess and disproportional fat accumulation at legs and arms. Basically, the diagnosis of lipedema is done with physical examination and patient history. So if you complain excess swelling, especially ankle area, if you have some sensation problems, pain and bruises, which you don't realize how it has happened, this is a complaint part, and physically there is an identical shape of lipedema patients, which is there is a serious disproportionate between body and legs and arms. When you gain weight, fatty acids collected especially arms and legs, but when you try to lose weight, you can hardly lose weight from legs and arms. And physically also disproportional fat accumulation at especially ankle area, lower legs, the cellulitis feature of the skin make us think that you have lipedema. Definition of lipedema, we have two different definitions. One is stage, the other one is type. Stage shows us the progression of your disease. Type shows which parts of your arms and legs are involved. In type, for example, if you're just hips affected, it's type 1. If your thighs affected, it's type 2. If your full legs affected, it's type 3. If your arms affected, type 4. And if just lower legs affected, it is type 5. Stage shows the progression. If you are in stage 1, it is the lowest degree. Yes, your legs or arms affected, but there is no very clear cellulitis seen, and your fat accumulation is hardly considered as lipedema. If you progress more, it's the second stage, it's moderate stage. Your thighs and lower legs maybe, or arms, it is very clear that you have something wrong with your arms and legs. The fat accumulation show us identically lipedema. In stage 3, your legs and thighs fat accumulation is very clear that you have lipedema. You have cellulitis seen too much, especially thighs, lower legs and arms. You have excess skin. And there is one more stage, which is lympholipedema. It is stage 4. In that stage, your excess fat collection affects the lymphatic flow, and lymphedema component is involved in stage 4. Basically, there are two types of treatments. One is non-surgical treatments, the other one is surgical treatments. Non-surgical treatments are diet, sports, which we say lifestyle change, manual lymphatic drainage, and compression garments. If you really obey the lifestyle change strictly, you can have very good results, these non-surgical treatments. However, if you gain weight, you're gonna see that you can easily go back to your first scene of your legs. So the most effective treatment in lipedema is removing the fat cells, which is surgical treatment. The second choice for a lipedema treatment is surgical treatment. What we do in surgical treatment is we remove the excess fat from thighs, legs and arms. Lipedema is a chronic disease, is a progressive disease. If you really want a successful treatment, we have to remove the excess fat cells from your body. One of the most frequently asked questions is, the surgery is permanent, the results are permanent or not? Yes, it is permanent if you keep your weight stable. Of course, 3-5 kilos, maybe 10 kilos does not affect your treatment result too much, but if you gain weight too much, yes, it's possibly affect your final result, and you can see some fat collections at your legs and arms. So we can think that fat cells behaves like something in your body, like a tumor. So what we do is remove these excess cells out and make your body free of these cells. Lipedema is a progressive disease, so if you are not diagnosed early, your illness can progress. How it happened? Actually, weight management is very important in the progress of lipedema. So if you don't obey the strict diet rules, which is low-carb diets especially, and fermented foods like cheese, yogurt, or wine especially, or beer, you can see progress on your lipedema levels. And also pregnancies, puberty, and menopause periods. If you gain weight too much without diagnosis, if you don't take care of yourself too much, you cannot lose weight as much as you want from your legs and arms. So this makes your shape worse than before. That's why it's the best condition for lipedema is early diagnosed, and if possible, try have your treatment surgically or non-surgically.